Can knock knees be corrected? If you or someone you know is dealing with knock knees, you might be wondering if there's a way to correct this condition. Let's break it down and see what the options are. First, it's important to understand that knock knees, also known as Genu valgum, are quite common, especially in children. In many cases, knock knees correct themselves as the child grows. However, if the condition persists beyond the age of 7, it might need some attention. For children with persistent knock knees, non-surgical treatments can be effective. One common method is using a night brace attached to an orthopedic shoe. This helps to align the knees properly while the child sleeps. If the separation between the ankles is severe, or if non-surgical methods don't work, surgery might be necessary. There are a few surgical options available. For example, osteotomy surgery can correct more severe deformities by cutting and realigning the bone. This procedure aims to correct limb alignment, stop disease progression, and reduce the risk of joint degeneration. Another surgical method involves using an external fixator, which is an adjustable frame connected to the bone with wires and pins. This frame is adjusted daily to gradually correct the knock knee over time. The patient can continue with their daily activities while wearing the frame, and it is removed once the bone has healed in the corrected position. In some cases, especially if there are underlying metabolic or kidney issues, medical treatment such as vitamin D and phosphorus replacements might be necessary before considering surgery. For adults, the approach can be similar, focusing on exercises to strengthen and stretch the muscles around the hips and knees. For instance, exercises like the figure for stretch, seated external rotation stretch, and squats with resistance bands can help improve knee alignment and reduce the appearance of knock knees. So, to answer your question, yes, knock knees can be corrected through a combination of non-surgical treatments and, if necessary, surgical interventions. The key is to identify the underlying cause and choose the most appropriate treatment option. Whether it's through braces, physical therapy, or surgery, there are ways to address and correct knock knees effectively.